Let us be honest. When it comes to men's health, one question never seems to go away. Does size really matter? You hear it everywhere, from late-night jokes and locker room banter to awkward remarks at family dinners. On social media, it is even louder. Memes, exaggerations, bragging, complaints. Behind all that noise is a man who quietly wonders, am I normal? Do I measure up? What do women actually want? Here is the truth. The answer is far more comforting and far more surprising than you probably think. Stay with me, because today we are going to separate fact from fiction. We will look at what the best research shows about women's preferences, why the myths are so powerful, and the everyday habits that quietly damage men's confidence far more than any ruler ever could. Quick pause. Tell me in the comments where you are watching from today. I love seeing how far this men's health community reaches. And while you are here, tap like and subscribe. It helps us keep bringing you honest, practical health insights without shame, stigma, or gimmicks. The myth is simple. Bigger is always better. Movies, jokes, and even a few loud friends may reinforce that idea. Science tells a different story. Across multiple studies, when women make private choices without pressure or social influence, the strong preference is for average size. Not extremes. Not the cartoonish images that flood the internet. Average. Why? Because satisfying intimacy is about comfort, connection, communication, and pleasure, not about maximizing inches. Here is the most reassuring part. The vast majority of men already fall into that preferred range. For those who do not know me, I am Dr. Fiona Grey, a relationship psychologist and sex educator. For over 7 years, I have helped men protect their confidence, improve intimacy, and restore dignity in how they view their bodies and their relationships. I have had hundreds of men sit across from me with the same quiet concern. I am worried I am not enough. I have seen how that fear can erode not only the bedroom, but also marriages, self-esteem, and even career confidence. That is why I want to walk you through the real science and then share the 5 biggest mistakes men make with this issue, along with clear action steps to replace insecurity with grounded confidence. Mistake number 1, believing media myths. Biologically, the average erect length is roughly 5 to 6 inches, with an average girth of about 4.5 to 5 inches. Studies of best-selling intimate products show that women overwhelmingly choose sizes in that same range when they are making private, pressure-free selections. Emotionally, when men compare themselves to unrealistic media, they create anxiety and shame, even though they already sit squarely in the normal range. Practically, stop comparing yourself to movies, edited images, or exaggerated stories. Private preferences reflect reality, not fantasy. The more you consume extremes, the more distorted your self-image becomes. Mistake number 2, ignoring comfort and fit. Biologically, the female body is designed to prioritize comfort and safety. Excessive girth or length can cause discomfort or pain rather than pleasure. Emotionally, many women value trust, safety, and a sense of closeness far more than size. They do not want sex to feel like a performance. They want it to feel like connection. Practically, focus on pacing, communication, lubrication, and positioning. These variables matter far more for satisfaction than another half-inch ever could. Ask what feels best. Adjust your angle, rhythm, and depth with care. Comfort creates relaxation. Relaxation allows arousal. Mistake number 3, assuming all women want the same thing. Biologically, research shows individual variation. Women who report vaginal orgasms sometimes show a mild preference for slightly above average length. But we are talking about modest differences, often around 6.5 inches, not extremes. Emotionally, preferences differ widely. Some care about size, many do not care at all, and most value confidence, intimacy, and communication across the board. Practically, change the question from, "Am I enough?" to what makes you feel most comfortable and most connected. That single shift can transform your experience together because it moves you from comparison to collaboration. Mistake number 4, neglecting overall health. Biologically, erectile quality depends far more on circulation, hormones, and nervous system balance than on size. Dehydration, smoking, excessive alcohol, poor sleep, high stress, and a sedentary lifestyle undermine blood flow and confidence. Emotionally, a man who invests in energy, fitness, and presence feels attractive and capable regardless of measurements. Practically, take charge of the basics. Hydrate consistently. Move your body most days of the week. Prioritize sleep. Manage stress with breath work, walks, lifting, or whatever helps you reset. Women consistently rank vitality, kindness, and reliability above any physical extreme. Mistake number 5, letting insecurity run the bedroom. Biologically, anxiety activates stress hormones, raises cortisol, lowers testosterone, and constricts blood flow. That combination leads to softer erections, quicker loss of firmness, and less pleasure for both partners. Emotionally, many men enter intimacy worrying about how big instead of focusing on connection, touch, breath, and presence. Partners sense that anxiety and the moment breaks. Practically, replace comparison with grounded confidence. Slow down, breathe, make eye contact, track her breath, and match it. Remember that you are more than enough when you show up with patience, curiosity, and attentiveness. So what can you do starting today? Stop the comparison trap. Unfollow accounts that fuel insecurity. Protect your mind the same way you would protect your heart. Learn the real averages. 5 to 6 inches in length and 4.5 to 5 inches in girth capture the center of the distribution. Most men are already there. Shift focus to skills, communication, foreplay, arousal pacing, and trust consistently rank higher for women than size. Learn how to read breath, sound, and micro movements. Learn how to slow down and build anticipation. Invest in health. Strong circulation, good sleep, hydration, strength training, and hormone balance matter far more than an extra inch. Your habits shape your experience. Practice confidence rituals. Before intimacy, take a slow breath. Place your attention on your partner and remind yourself, I am enough, and I am here to connect, not to perform. That small reset lowers anxiety and improves blood flow in minutes. I know this topic is loaded with emotion. Some of you have carried insecurities since your teenage years. Maybe someone made a cruel comment. Maybe you have worried quietly every time a new relationship began. Here is the truth. The science is on your side. You are normal. You are enough. You are fully capable of deeply satisfying your partner. Not because of a number on a ruler, but because of who you are and how you connect, listen, and care. Let me leave you with this. Confidence does not come from chasing extremes. It comes from understanding reality, taking care of your body, and showing up with presence and respect. Age is not the end of vitality. For many men, the 50s and 60s become the most confident years precisely because they let go of comparison and step fully into connection. Hold your head high. You do not need to measure up to myths. You need to measure up to yourself, and that is more than enough. If you found this reassuring, please like this video, subscribe, and share it with a friend who needs to hear the truth. I am Dr. Fiona Grey, reminding you that your worth is not defined by inches. It is defined by confidence, health, kindness, and the love you bring into every relationship. Stay strong, stay confident, and remember that you are enough.